David and I met through two mutual friends, Dr. Christina Notoriani and Dr. Andrew Warner. David used to go to their house to cook all the time. I went over one day for dinner, and David was cooking, and that's how we met. I kept showing up to their house for dinner, and he kept cooking me dinner, and so eventually we started dating, and then that's how we got together.
I live across the street from David, so I've known them for some time. I know David's an experienced cook, and we used to have dinner parties, and he would cook and things of that nature. So I've known them socially and Marjorie professionally as well.
David is the sweetest and most loving person I know. He has a very large group of friends here in Shreveport. He will do anything for you if you ask him to. He has taught me how to enjoy my life more and work a little bit less.
So I think David is kind of one of the people that doesn't meet a stranger. I think that's a pretty good descriptor. Very gregarious, I think overall. Even people that haven't met him before, they somewhat migrate to his personality.
It was a typical day. At about 11 o'clock, we talked about going to the movies that afternoon. So I called him to try to figure out where we're going to meet to go to the movies, and he wasn't answering his phone, which was sort of strange. And so I went to his house, and I walked in, and he was on the floor, and he looked up at me and turned his head, but couldn't actually speak. And when I saw him, I could tell that the right side of his face, he had a droop, his lip was down, and his arm was flexed. And so I looked over and I said, "Oh my God, David, you're having a stroke." Fortunately, his phone was on his bedside table, and so I called an ambulance. And then I called my neighbor across the street, Dr. Peter Campbell, who's a neurosurgeon, and I said, "Listen, I think David's having a stroke. Could you just come over?"
I was headed back from work, and just by happenstance, I was maybe 30 seconds away. I just kind of pulled in his driveway instead of my driveway.
And so he came over and he said, "No, he's having a stroke. You really only have 3 hours from the time that the onset of the stroke happens until you can get therapy to try to help prevent anything worse from happening." And so he was already 45 minutes into his stroke when I found him. And God, those 5 minutes the ambulance took to get to the house were the longest 5 minutes of my life.
And they came in and picked him up within 3 to 5 minutes, and they were gone.
I believe Mr. Bates at the time was found down around 1 p.m. and he arrived at the hospital around 1:30 p.m. So the stroke team was ready for him in the emergency department, and we started with the workup. In terms of David's symptoms, he was having what would be considered a moderate to severe stroke. He was having right side paralysis, right side facial droop, and problems with his speech, as well as his gaze was deviated to the left, meaning he could not look to the right.
He had very obvious symptoms of stroke less than an hour after he was last seen normal.
David was taken to the CT scanner right away. That confirmed that he was having an ischemic stroke with an occlusion of his left carotid artery that was extending up into the brain into the left middle cerebral artery, basically blocking the blood flow to the left side of his brain.
We identified immediately that there was no hemorrhage, so strokes being either hemorrhage or clot. He didn't have the bleed or hemorrhage. So we noticed that his blood pressure was really elevated, and we decided that the course would be to go ahead and get the blood pressure lowered so that he would be eligible for the clot busting TPA, and it's tissue plasminogen activator.
So it's very important to identify those stroke symptoms right away. The longer time passes, the more neurons are going to be lost. The sooner we get to a patient with stroke symptoms, the best chance we have to have that patient come back to their baseline. In David's case, he was a candidate for both the clot-busting medicine, TPA, and also to manually remove that clot via a procedure called thrombectomy, in which we go from the groin with a small catheter and some devices, and we can pull that clot out of the brain and restore the blood flow.
I didn't have time to panic or process. I had to deal with the situation in front of me. I didn't worry with Dr. Quaylar because he has such a good reputation and he's such a good doctor. In my mind, I thought, well, if anybody can take care of this, it'll be Dr. Quaylar. I knew he was in good hands.
Once the TPA was started, David was wheeled into the OR. We accessed a femoral artery in his groin. Through that artery, we put a sheath, and through that sheath, we advanced a guide catheter into the area that is blocked. In David's case was the left carotid artery. We put our catheter in the left carotid artery, and then we advance some devices, a stent retriever that removes the clot, and the other one is a aspiration catheter that basically aspirates the clot out. He had two blockages at the same time, one at the level of the neck and the other one inside the brain. So we have to tackle first the one in the neck so we can access the brain. We open the carotid artery in the neck, then we go through that and then access the brain and remove the clot that's in the brain. So we advance those catheters into David's left carotid artery. We perform the thrombectomy by removing and aspirating the clot at the same time, and we're able to restore the blood flow.
Post-thrombectomy, he comes back to the unit, and in trying to see what kind of damage was done from the stroke, what we could do to rehabilitate him and get him back to as much function as we can. He was severe enough we did not know he was going to survive the insult to his brain.
I think the scariest part for us was not knowing what was going to happen next. He woke up after they took the clot out and everything settled. And then I had to tell his friends. And that was hard because he has a lot of friends. And I remember them at bedside, some of them crying, and it was really hard for us.
He could not speak, couldn't follow commands. We tried to get him to say their name, move limbs, anything that would help determine their level of consciousness. He was so far down on the scale that he couldn't respond to me at the time.
He couldn't move his right side, and he kept telling me he couldn't feel his leg and he couldn't feel his arm. We just didn't know. Was this going to be like this for the rest of his life? Was he going to be able to walk? Is he going to be in a wheelchair for the rest of his life? What are we going to do?
We immediately, 24 hours after they've had this procedure, we start them on physical therapy because that's another important part of the stroke rehabilitation. He had a hospital stay of about 10 days. He worked with physical therapy, occupational therapy, multiple other services that took care of David.
Hey, Marjorie.
Hey Marjorie, how are you, baby?
Thank you.
Thank you for the open.
Happy Valentine's Day.
Happy Valentine's Day.
All right. Bye, baby.
Bye.
We were so happy the day we got the call that he was going to rehab. I remember walking into his room and he looked at me and I said, "You've been approved." He was so excited, and so we finally, it was good.
After that, I went down to Houston and did a couple of hospitals down there for recovery, and then we came back to Shreveport, and I gotten into rehab up here.
That was a good day. He was on the phone the whole ride back talking to all of his friends about how he was coming home. He was so excited.
We received his referral about probably 6 months post-stroke, once he was discharged home, to come for outpatient services at the LSU faculty clinic. We knew that he was pretty much total assist at one point and that he had progressed to about moderate assist with his mobility, but he still needed significant assistance with most of his activities of daily living.
All I really wanted was for him to be able to just get up out of his chair, pivot, and sit back down. I thought if we can do that, then we can pretty much get through the rest of our lives. That'll be okay, because then that meant that we could travel, we could get on a plane, we could get in and out of a car.
I can remember when we first started working with him, just to stand up from his chair, he'd have to rock and think and rock and think. It'd take him sometimes 3 or 4 minutes to figure out how to stand up from the chair, even though physically his strength was there, his balance was there, and his coordination was there. So his motor planning was so impaired, he couldn't figure out how to tell his body to move. At one of our sessions prior to the last time I saw him, I said, "David, I need you to stand up from that chair, walk over and get in the bed, and then sit back up and get out of the bed." And he was able to do that without me touching him. And that was huge for him, because that was something that made him have to have extra assistance and limited his ability to get up and do things for himself, because he was stuck on his back flat in the bed. And this was even a year after he'd initially had the stroke.
and he was diligent about coming to therapies. He tried as best that he could when he was there with us, jokes every step along the way. So you have to be able to keep up with his humor to be able to get him to do his therapy.
Hi. How are you, baby? That's it.
I love you.
I'm done.
Right now I'm going 3 days a week, but I'm going to start going a little bit more later in the summer. I mean walking, and that's the biggest one that I'm trying to do. But just get better all around.
Recovery from a stroke is really slow. David's recovery is still ongoing, and it's been 2 years. It's almost a lifelong process, so you just have to take it day by day. We try to set smaller goals and expectations, and things just go as they go. It took us almost 4 months for him to be able to just get up and walk, but he makes small gains in long increments of time.
I need some help getting out of bed and all. I got to put on a brace on my leg. And past that and all, I guess I'm getting kind of independent, and that's a good thing. Now my cooking is mostly telling other people how to do it, as opposed to actually being on the stove cooking.
He probably makes the best jambalaya this side of Mississippi. And I thought it was gone. But we had these people come to the house. David would plan what he would make for them, and with his attendant, he would make it. And so he made jambalaya for them one day, and I took a bite, and I was like, oh my God, this is just like he made it. He'll sit with me in the kitchen. He'll tell me what to do, and thanks to him guiding me through it and telling me what to do, it still comes out delicious. I've worked in a level 1 trauma center my whole life, and I've always said, your life changes in an instant. I mean, he was fine until he wasn't, and then everything changed in an instant.
Seeing patients come back and see them being able to be independent, it gives us a sense of purpose. It validates what we do. We're just very excited to be able to help patients in this community to achieve good outcomes when they're having a stroke.
Quite frankly, in any given shift, I might have 4 to 6 stroke patients. So now finding out that this case turned out well is very encouraging for me, because I'm knowing that the things that I do every day are making difference.
He had reached a point where we thought he would survive, but we figured he would be bedridden for the rest of his life. So to see him after the fact and how well he was doing was just, I don't know, it just makes it all worthwhile.
Well, the stroke team at Ochsner LSU, to me, is the best team that there is. From the attendings to the residents to the nurses, technicians, everybody involved in the patient care, it's very committed to provide the best care to our patients.
If we didn't have the specialized care that we have at the School of Allied Health Professions and Ochsner LSU, someone like David would ultimately not be able to make the same progress because he wouldn't have those resources available.
Anytime you have a stroke, there's an increased risk of death. The amount of morbidity and mortality that Ochsner LSU Health has prevented in this area is astounding.
This is the area with the higher incidence of stroke in the nation. So that's why it's important that we develop these systems of care that can provide patients with access to facilities that can treat those strokes in a timely manner, and we can help these patients have good outcomes.
Thank you just seems so little for everything that they've done, because without all of their help, David wouldn't be here today.
Nobody thought I was going to be able to come back this much after that. Well, it was a big stroke, and I think I've gone past what most folks thought I would be able to do. So I'd like to thank them for all they've done. I'd want to tell them how grateful I am for bringing me back.